morning, sir.
Good morning. Good morning.
Thank you. Are you happy to be here today?
Yeah, I'm very happy to be here. Although I'm the organizer of the program and seeing people around, yes, I'm very happy.
All right. Can you kindly tell us your name?
My name is Wojo Adekende Samuel. I'm the national president, Andro Scientific. Andro Scientific is a consortium of medical laboratory scientists that have special interest in reproductive science, technology, and andrology.
All right. Can you quickly give us a briefing on the program today?
You know, this is the 10th edition of this symposium. We call it Andrology Symposium every year. But for this 10th year, we are talking about bridging the gap in infertility care, innovation challenges, and the role of healthcare providers. That is what we are talking about today. This is an avenue whereby all the key players in infertility care will come together and discuss how their roles help in the diagnosis, treatment, and management of infertility.
Wow, thank you so much, sir. Thank you.
I'm Dr. Toyosi Rahim. I served as the chairman of the opening ceremony for this program. The event, like we all know, is the 10th of its type, which means it started 10 years ago. And this year again, the Andro Scientific is bringing participants, policymakers, scientists, clinicians, and all the critical stakeholders in the health sector together to discuss on how best to attend to cases of infertility and provide the best care for people with cases of infertility. So that is the essence of coming together. And various experts have been invited to speak to the various critical topics that will guide better professional care to people with infertility.
It's nice to have you here. Could you kindly introduce yourself?
I'm Professor Kolawole Solomon Oyedeji.
Professor Kolawole, could you please give us a briefing on the theme of today's event?
The theme of today's event is simply bridging the gap. That's where I'm going to look at it. Again, bridging the gap in terms of infertility and infertility care. There are two different things, but it's actually lumped up so that we could be clear. We are bridging the gap of infertility and infertility, and what that means is that there is a gap that should be bridged. And there are a lot of things that need to be put together to bridge the gap. One, we're in the era of digital, so we'll be thinking of innovations. Number two, we need to also look at, as good as anything is, there must be challenges about it. And the third one we'll be looking at is, what is our role? Those of us that are involved in this setting up the bridge.
That's the insightful educative part to let us know what our role is.
Exactly. Actually, and the role will not only stop on healthcare professionals. There's a diagram I always draw, which is actually a triangle. A triangle has three angles. So on the first angle, I'll put the society there. Then on the second angle, I'll put the fertile. And the third angle, I'll put the infertile. And I can ask people, where do you belong out of these angles? There is no way you will not belong to two of them. You are either fertile and in the society, or you are infertile and in the society. And that takes you to what we call a vicious cycle, where the society, the fertile and infertile are intermingled. So that role will now be spelled out. What is your role as a parent? What's your role as a society? What's my role as a neighbor? What's your role even as a scientist, whether healthcare or elsewhere? That's what we're unraveling in today's conference. The conference is, I will look at it as socio-scientific. You know, when people hear science, they are scared because they're looking at the technicality of the things that will be mentioned. But you'll be surprised there today. We'll have more of social science approach to the fertility care in Nigeria. Thank you very much.
Thank you so much, sir. How insightful. Thank you, sir.